A technician discovers that an orthopedic instrument set processed yesterday shows dried water spots inside the lumens. What is the most likely cause? A. Incomplete drying cycle due to overloaded chamber. B. Improper packaging technique using heavy wraps. C. Excessive use of enzymatic detergent. D. Failure to use distilled water during final rinse. Answer: D. Tap water leaves mineral deposits that appear as spots inside lumens. Using distilled or deionized water prevents residue. During weekly quality audits, a tray is found with an incorrect count sheet. Which infection control risk does this pose? A. Wrong sterilizer cycle selection. B. Instruments bypassing inspection. C. Excessive moisture retention. D. Biofilm development in washer. Answer: B. If the count sheet is wrong, instruments may skip proper inspection or cleaning, leading to contaminated instruments being used on patients. A load of surgical instruments is released before the biological indicator results are available. What is the major concern? A. Delayed turnover time. B. Prolonged aeration cycle. C. Compromised sterility assurance level. D. Reduced shelf life of packaging. Answer: C. Biological indicators confirm sterilization. Releasing loads before BI results undermines sterility assurance and violates AAMI standards. In the decontamination area, instruments with heavy bone cement residue are found. What is the safest corrective step? A. Use an alkaline cleaning agent designed for orthopedic instruments. B. Manually scrape cement off with a steel brush. C. Run them through the washer disinfector twice. D. Soak in saline overnight before cleaning. Answer: A. Specialized alkaline cleaners dissolve orthopedic debris like bone cement without damaging instruments, unlike scraping or saline soaking. A technician notices the autoclave printout shows a sudden drop in chamber pressure mid-cycle, but the indicator tape changed color. What should be done? A. Accept the load since indicators changed. B. Reprocess the entire load after corrective maintenance. C. Quarantine only implantable items. D. Release the load and monitor patients. Answer: B. A cycle failure cannot be ignored, even if tape changes color. Full reprocessing ensures sterility assurance. When processing flexible endoscopes, which infection control error is most critical? A. Using a neutral pH detergent. B. Storing in a vertical drying cabinet. C. Skipping leak testing before reprocessing. D. Flushing channels with sterile water. Answer: C. Skipping leak testing risks internal fluid invasion, which makes scopes nearly impossible to disinfect fully, leading to infection outbreaks. A technician accidentally uses lubricating oil not approved for medical instruments. What is the greatest risk? A. Shortened sterilizer cycle. B. Residue preventing sterilant penetration. C. Reduced instrument sharpness. D. Excessive moisture retention during drying. Answer: B. Non-approved lubricants may create a barrier to sterilant penetration, leaving microbial contamination on instruments. A biological indicator placed in the densest tray of a load shows growth, but the other BI in a peel pouch passes. What does this indicate? A. Peel pouches are unreliable. B. BI was defective in the tray. C. The sterilizer temperature gauge is broken. D. Tray packaging prevented sterilant penetration. Answer: D. Failure in the tray but not in peel pouches points to packaging density or improper preparation blocking sterilant flow. During assembly, a technician forgets to open the jaws of hemostats. What is the main risk? A. They may bend during sterilization. B. Count sheets will not match instrument sets. C. Drying time will increase. D. Steam or gas will not reach the serrated surfaces. Answer: D. Closed jaws trap debris and prevent sterilant from reaching all surfaces, leaving the instrument contaminated. While unloading, a technician finds wet packs consistently on the bottom shelf of the sterilizer. Which is the most likely cause? A. Overheating of chamber walls. B. Inadequate airflow and drainage under heavy loads. C. Excessive lubrication on instruments. D. Too much biological indicator use. Answer: B. Wet packs at the bottom are often caused by poor drainage and air circulation when the chamber is overloaded, leading to moisture retention. A tray of neurosurgical instruments is repeatedly failing biological indicator tests, despite correct cycle settings. What is the first corrective action? A. Replace the autoclave chamber filters. B. Switch to low-temperature sterilization. C. Increase exposure time by 10 minutes. D. Review tray assembly and packaging density. Answer: D. Overpacked or incorrectly assembled trays block steam penetration, which is a common cause of BI failures in neurosurgical sets. A technician finds corrosion starting on micro scissors after ultrasonic cleaning. What is the most likely cause? A. Excessive cavitation cycles. B. Use of saline during cleaning. C. Incorrect enzymatic detergent dilution. D. Storing instruments in open position. Answer: B. Saline corrodes stainless steel instruments rapidly. It should never be used for soaking or cleaning. An orthopedic tray is sterilized in a pre-vacuum cycle, but condensation remains after drying. Which factor most contributes? A. Use of muslin wraps. B. Chamber vacuum pump malfunction. C. Incomplete warm-up cycle. D. Absence of wicking material in the set. Answer: D. Without wicking material, steam condenses inside large sets, preventing complete drying and risking contamination. A facility reports staining on instruments after every steam cycle. Which parameters should be checked first? A. Water quality for mineral content. B. Temperature calibration of autoclave. C. Drying cycle duration. D. Use of Class 5 integrators. Answer: A. Mineral-rich water leaves stains and residue. Sterile processing requires deionized or distilled water for final rinse and steam. A technician accidentally loads peel pouches with chemical indicators facing away from the sterilant flow. What is the main risk? A. Indicator may not reflect true sterilization exposure. B. Instruments may corrode inside the pouch. C. Shelf life of packaging is shortened. D. Pouches will burst during the cycle. Answer: A. Indicators placed incorrectly may not change, giving false results and risking release of unsterile instruments. A flexible endoscope is stored in a horizontal cabinet with closed caps. Which infection risk is most concerning? A. Rapid drying of insertion tube. B. Insufficient air circulation leading to microbial growth. C. Overexposure to disinfectant fumes. D. Reduced lens clarity. Answer: B. Endoscopes must be stored vertically with caps removed to prevent moisture buildup and microbial growth inside channels. After sterilization, a technician notes that a load sticker was applied to the outside of the wrapper using ink not designed for sterilization. What is the concern? A. Ink can transfer and compromise sterility. B. Load number will not be visible. C. Indicator tape is unnecessary. D. Cycle printout is invalid. Answer: A. Non-sterile ink may leach chemicals through the wrap, compromising packaging integrity and sterility. A set of laparoscopic instruments repeatedly fails electrical insulation tests. What should be done? A. Continue use after steam sterilization. B. Replace insulation sleeves immediately. C. Run a biological indicator test load. D. Switch to ultrasonic cleaning. Answer: B. Damaged insulation creates a burn risk to patients. Instruments must be repaired or replaced before reuse. An implant load is sterilized, but the BI result shows failure. What is the only correct step? A. Release the load with a Class 5 chemical integrator. B. Quarantine the implants until a passing BI is documented. C. Extend drying time and reprocess. D. Notify the surgeon to proceed with caution. Answer: B. Implants require BI verification. They must remain quarantined until a passing BI confirms sterility. A washer disinfector is leaving detergent residue on trays. Which issue is most likely? A. Faulty final rinse water supply. B. Excessive enzymatic cleaner use. C. Pre-wash time too short. D. High chamber temperature. Answer: A. A poor or missing final rinse with treated water allows detergent residues to remain, causing spotting and corrosion. During inspection, a cracked lens is found on a laparoscope. Why is this an infection risk? A. Crack reduces sterilizer heat penetration. B. Microorganisms can lodge inside and survive sterilization. C. Lens crack increases drying cycle time. D. Lens coating reacts with detergents. Answer: B. Cracks harbor microorganisms that may not be reached by sterilant, making the instrument unsafe for use. A tray comes out of sterilization with visible condensation. Which action should the technician take first? A. Return tray to drying cabinet. B. Release the tray after cool down. C. Consider the tray contaminated and reprocess. D. Blot dry with sterile towel. Answer: C. Moisture compromises sterility. Wet packs must always be considered non-sterile and fully reprocessed. A technician fails to log the sterilizer cycle in the tracking system. Which regulation is violated? A. Event-related sterility principle. B. Documentation and traceability standard. C. AAMI water quality guidelines. D. Packaging integrity requirement. Answer: B. Documentation ensures traceability of loads for recalls. Missing entries violate sterility assurance standards. Which error during ultrasonic cleaning most increases infection risk? A. Not changing solution between loads. B. Leaving lid open during cycle. C. Running instruments without baskets. D. Using too high water temperature. Answer: A. Reusing dirty ultrasonic solution allows bioburden to spread, contaminating all instruments in the next load. A facility switches from steam to ozone sterilization. Which packaging must be discontinued? A. Rigid containers with filters. B. Tyvek pouches. C. Cellulose-based wraps. D. Aluminum trays. Answer: C. Ozone sterilization is incompatible with cellulose-based wraps because they absorb sterilant and block penetration. A technician notices that delicate ophthalmic instruments are repeatedly losing sharpness. Which practice is most likely responsible? A. Using wrong lubricants. B. Processing in ultrasonic cleaners too frequently. C. Running in extended steam cycles. D. Assembling with heavy retractors in same set. Answer: B. Frequent ultrasonic cleaning can erode delicate instrument edges. A technician finds that peel pouches are ballooning during plasma sterilization. What caused this? A. Excess moisture inside packaging. B. Wrong cycle temperature. C. Double pouching with Tyvek. D. Low sterilant concentration. Answer A. Moisture expands into vapor under sterilization, ballooning or bursting pouches and compromising sterility. Why is biofilm on surgical instruments especially dangerous? A. It is visible and alerts staff to cleaning errors. B. It resists detergents and sterilants, protecting microbes. C. It increases spotting but not infection risk. D. It makes instruments heavier. Answer B. Biofilm shields microbes, making cleaning and sterilization ineffective and directly threatens patient safety. A technician discovers a rigid container lid does not seal properly. What should be done? A. Add extra wrap to the outside. B. Use tape to secure the lid. C. Remove container from service until repaired. D. Sterilize with extended exposure time. Answer C. A faulty seal compromises the sterile barrier. Containers must not be used until fully repaired. Which factor most impacts sterilization of instruments with long lumens? A. Exposure time. B. Sterilant penetration and air removal. C. Chamber temperature. D. Indicator type used. Answer B. Long lumens trap air, preventing sterilant from reaching internal surfaces unless air is fully evacuated. A technician leaves decontamination area wearing PP into the clean assembly room. What is the main concern? A. PP will spread microorganisms to clean areas. B. PP may damage instruments during assembly. C. Gloves interfere with count sheets. D. Gown fibers reduce sterility of wraps. Answer A. Cross-contamination occurs if dirty PP is worn in clean zones, violating workflow separation. A washer disinfector cycle consistently ends with cloudy water stains on instruments. What is most likely wrong? A. Rinse water has high mineral content. B. Temperature settings are too low. C. Overuse of enzymatic cleaner. D. Ultrasonic cavitation not functioning. Answer A. Hard water leaves mineral deposits. Treated or deionized water is required for rinsing. Which packaging error most compromises sterility during transport? A. Using autoclave tape on rigid containers. B. Wrapping sets with double-ply material. C. Placing too many pouches in one basket. D. Folding corners too tightly, causing tears. Answer D. Tension tears in wrap allow microbial entry during transport, compromising sterility. An instrument set is sterilized in ETO, but aeration time is shortened to meet a surgical deadline. What is the primary risk? A. Load will remain wet. B. Toxic residues will harm patients. C. Instruments will corrode. D. Cycle printout will be invalid. Answer B. Inadequate aeration leaves harmful ETO residues, posing direct patient toxicity risk. A technician finds dried blood on instruments after automated cleaning. What is the first action? A. Run the set again through the washer. B. Report and manually clean instruments before reprocessing. C. Proceed with sterilization cycle. D. Soak in saline overnight. Answer B. Visible soil after cleaning must be corrected with manual cleaning before reprocessing, or sterility is impossible. Which step ensures traceability of instruments to a specific patient? A. Using sterilizer load stickers. B. Attaching count sheets. C. Recording unique device identifier, UDI. D. Applying Class 5 integrators. Answer: C. UDI and tracking systems link instruments directly to patients, ensuring accountability and recallability. What is the greatest risk if a technician assembles trays while skipping magnification inspection? A. Wrapping material may fail. B. Cracks or debris may be missed. C. Load sticker cannot be applied. D. Sterilizer temperature must increase. Answer: B. Fine cracks, nicks, and debris invisible to the naked eye are missed, risking surgical infections. Which is the first step when a sterilizer biological indicator test fails? A. Recall all loads processed since the last negative BI. B. Rerun the cycle with chemical indicators. C. Continue using sterilizer until maintenance checks. D. Rewrap the load and return it to inventory. Answer: A. A failed BI requires immediate recall of all affected loads until sterility assurance is verified. A technician adds lubrication oil directly inside instrument lumens. What is the main concern? A. Instruments will stick together. B. Sterilant penetration will be blocked. C. Drying time will increase. D. Indicators will fail to change color. Answer: B. Oil inside lumens prevents sterilant from contacting internal surfaces, leaving them contaminated. Which practice most reduces infection risk when handling sterile packages? A. Holding packages close to the chest. B. Checking for tears or moisture before opening. C. Opening with wet hands after washing. D. Using scissors to cut wrappers open. Answer: B. Visual inspection ensures integrity. Wet hands or sharp tools increase contamination risks. A technician finds mismatched metal types in the same tray, stainless steel and aluminum. What is the risk? A. Heat transfer will be uneven. B. Drying will take longer. C. Instruments will weigh too much. D. Galvanic corrosion can occur during sterilization. Answer: D. Dissimilar metals in moist conditions cause galvanic corrosion, reducing lifespan of instruments. During routine testing, a washer disinfector shows inadequate protein removal. Which corrective action is most appropriate? A. Increase detergent concentration. B. Recalibrate spray arms and nozzles. C. Shorten the wash cycle. D. Use saline for pre-soaking. Answer: B. Clogged or misaligned spray arms reduce mechanical cleaning, leaving proteins behind. Which is the main concern when trays are stacked too tightly in sterile storage? A. Wrapping materials wrinkle. B. Class 1 indicators may not be visible. C. Shelf life shortens to 7 days. D. Sterile barrier can be compromised by friction. Answer: D. Tight stacking increases risk of tears and compromises packaging integrity. An instrument set arrives in decontamination with visible cement residue. If not removed, what risk occurs? A. Sterilizer sensors will fail. B. Debris prevents sterilant penetration. C. Instruments weigh more. D. Wrapping must be reinforced. Answer: B. Cement residue blocks sterilant contact, leaving microorganisms alive under hardened debris. What is the primary reason for daily air removal tests in pre-vacuum sterilizers? A. To ensure biological indicators are functional. B. To confirm chamber reaches correct temperature. C. To verify effective removal of residual air. D. To extend drying cycle length. Answer: C. Residual air prevents steam from contacting surfaces. Daily testing ensures full air removal. A technician loads sharp instruments with tips touching wrappers. What is the main concern? A. Tips may puncture wrap, compromising sterility. B. Tips dull faster in sterilizer. C. Drying cycle will increase. D. Instruments will shift during transport. Answer A. Punctures create direct pathways for microbes, invalidating sterility. Which storage practice most increases infection control risk? A. Storing sterile trays on open shelves under air vents. B. Keeping items in dust covers. C. Monitoring temperature and humidity. D. Rotating stock by first in, first out. Answer A. Air vents blow dust and contaminants onto open shelves, compromising sterile barriers. Why should count sheets never be placed inside sterile trays without protective barrier? A. Ink can transfer and cause wrap tears. B. Paper fibers may shed and contaminate instruments. C. Sheets add unnecessary weight. D. They shorten sterilizer cycles. Answer B. Unprotected paper sheds fibers that harbor microorganisms, risking contamination. A technician fails to document lot control numbers for peel pouches. What is the consequence? A. Instruments cannot be recalled if sterility is compromised. B. Wrappers must be relabeled. C. Integrators will not be valid. D. Sterilizer chamber logs remain incomplete. Answer A. Without lot control numbers, tracking and recall are impossible, violating safety standards. A new staff member skips pre-cleaning in the OR before sending instruments to decontamination. What is the main risk? A. Washer disinfector runs longer cycles. B. Soil dries and forms biofilm, making cleaning ineffective. C. Trays become heavier for transport. D. Wrapping integrity is reduced. Answer B. Dried soil leads to biofilm, which cannot be removed easily and blocks sterilant penetration, posing severe infection risk.